This is Judy Klein. It's been a long time since my last video, but with the recent emergency use authorization of the Pfizer vaccine, I've had lots of questions about the COVID vaccine, so I thought I would answer some of them. The first question I've had is, how do the Pfizer and Moderna vaccines work? So the Pfizer and Moderna vaccines are mRNA or messenger RNA vaccines. While this is the first time such a vaccine has been created, this is not new technology. The messenger RNA being used is a molecule that encodes the spike protein of the Kovid virus. That's the thing that gives the virus its halo appearance. This is injected into your muscle, where it's taken into your cells. It never enters the nucleus of the cell where your DNA is, so it can't mess with or insert itself into your own DNA. You're not going to become a zombie or a GMO. Once in your cell, the mRNA uses your cellular machinery to make the spike protein of the COVID virus. That protein then exits your cells, is seen by your immune system as something foreign, and your immune system begins to make antibodies against that protein. In the future, if the actual COVID virus tries to infect you, these antibodies can bind to the spike protein on the virus they're already made and prevent it from being able to enter your cells. If the virus can't enter your cells, it can't make copies of itself, and you won't get sick. So how effective are these vaccines? And the answer is very effective, more effective than we expected them to be. When people who got the real vaccine were compared with people who got a placebo vaccine, they were 95% less likely to get symptomatic COVID. And this was true pretty much with both the Pfizer and Moderna vaccines. Also, all or nearly all of the people who required hospitalization for severe disease were in the placebo group, so not the group that actually got the real vaccine. So do I really need both shots in the series? The Pfizer requires 2 shots 3 weeks apart, the Moderna 2 shots 4 weeks apart. And the answer is yes. After 1 shot, you are 50% less likely to get symptomatic COVID. After 2 shots, you are 95% less likely, a significant boost. So the second shot offers your immune system another opportunity to see the spike protein and build up a stronger immune response. Can I get my first shot with one type of vaccine, the Pfizer, for example, and the second with a different type, the Moderna, for example? And the answer is no, not at this point. The studies that examined how effective these vaccines were not done with mixtures of different kinds of vaccines. It's just not clear that this approach would work, so it's recommended that you stick with the vaccines from one manufacturer. Can I get COVID from these vaccines? No, you cannot. These vaccines do not contain the actual COVID virus, just code that allows your body to make the spike protein. That spike protein itself cannot give you COVID. You need the whole virus to make you sick. If I already have had COVID, should I get the vaccine? And the answer is yes. In the studies on these vaccines, people who had been previously infected were included, and it's thought that the vaccine can actually help boost the immunity you may have already developed from natural infection. There was no evidence that getting the vaccine if you had already had COVID was harmful. If you are still having symptoms of COVID, though, you should wait until your symptoms have resolved before getting the vaccine. This protects healthcare workers who are administering the vaccine and those who are getting their vaccines. What sort of side effects can I expect, and how long will they last? I can speak to these. I just got my vaccine yesterday. And the most common side effect, these occur because your body is mounting an immune response to the spike protein. They are quite normal with vaccines and not a cause for alarm. This includes pain or redness at the injection site. I've gotten the pain, not the redness. Muscle or joint aches, fatigue, low-grade fever, and mild headache. I haven't had any of these. At least one of these occurs in approximately 3/4 of people who get the vaccine. The younger you are, the more likely you are to get these symptoms because your immune system is more vigorous in its response. And these symptoms are more common after the second injection and typically resolved within 48 hours of getting the vaccine. Acetaminophen or ibuprofen can be taken to relieve the symptoms if you need it. This is another very important question. What should I do if I have a history of allergic reactions but not anaphylaxis? What do I do if I have a history of anaphylaxis? Should I take the vaccine? If you have a history of allergic reactions but non-anaphylaxis, so anaphylaxis is when you get lip or tongue swelling, difficulty breathing, low blood pressure, vomiting. If you don't have that, you can get the vaccine after talking with your doctor. You'll be observed after the vaccination for at least 15 minutes to ensure you don't have an allergic reaction after you leave the vaccination facility. If you have a history of anaphylaxis to vaccines or any injectable medication, you probably shouldn't get the vaccine at this time. Consult with your doctor as to when enough research has been done on this issue. If you have a history of anaphylaxis but not to vaccines or injectable medications, once again, talk with your doctor, but you should consider getting vaccinated, particularly if you are in a higher risk group for infection, such as a nurse or teacher. Should I get this vaccine if I am pregnant, breastfeeding, or have a compromised immune system? These are individual decisions. The vaccine was not studied in pregnant or breastfeeding women or in people with compromised immune systems. That being said, pregnant women and those who are immunocompromised are at higher risk of serious COVID disease and would therefore really benefit from vaccination. If you're also in a group that at higher risk for contracting COVID, for example, say you're a healthcare worker, it may make sense to get the vaccine even before those studies are done. As for moms who are breastfeeding, these vaccines do not involve live virus and are really not thought to be of any risk for breastfeeding infants. Another great question, how long will the vaccine last? Will I need another one in a year like the flu, or is this more like the chickenpox vaccine where you're one and done? That's an excellent question, and the answer is we don't know. The makers of these vaccines will continue to follow the people in the studies to see how long effective immunity lasts with the vaccine. Maybe a year, maybe longer. It's possible that a booster will be required in the future. Can you tell me a little bit more how some of the other vaccines in the pipeline work? So I mentioned the Pfizer and Moderna vaccines are mRNA vaccines. There are other vaccines under development that involved injecting the spike protein itself, bypassing the step where our cells produce the protein and directly triggering the immune system to develop an immune response. That's the Novavax vaccine, for example. Another type of vaccine under development, these are the Oxford, Johnson & Johnson, and Merk vaccines. These insert genetic material encoding the spike protein into the DNA of a weakened form of a different virus, not a COVID virus, but a different virus like an adenovirus. This is a common cold virus. This weakened virus is not able to make you sick. Once it's injected as a vaccine, though, the virus enters your cells and utilizes your cellular machinery to produce the spike protein. Once again, your immune system then develops antibodies to this foreign protein. There are other approaches that are being used, but these are really the most common ones in the COVID vaccines under development. Do I still need to wear a mask and physically distance once I get vaccinated? The short answer is yes. We know that the vaccine is very effective in preventing symptomatic COVID, and if you get it, you're very unlikely to get seriously ill. What we don't know is whether the vaccine affects your likelihood of asymptomatic COVID. That is, when you're infected, can pass the disease on to others but have no symptoms. Since those results from the studies are not yet available under this emergency use authorization, masks and social distancing will still be necessary until at least 70%, but preferably more than 85% of the population is vaccinated. At that point, the virus will have such a difficult time finding a person who doesn't have immunity that it'll naturally die out. This is what's referred to as herd immunity. And finally, this is a little off topic, but very important. Is it safe for my kid to go back to in-person school during this surge during the pandemic? Once again, this is a very personal decision, but here's the science. Children very rarely get serious disease. There have been only 2 deaths of individuals under age 18 in California since the beginning of the pandemic. Children, particularly those under the age of 12, don't seem to be driving the transmission of this disease. They typically get the disease from adults, not other children. Here in Marin County, where I live, universal masking, social distancing, frequent hand washing, and good cross ventilation with open windows are part of the COVID protocol in schools. Careful collection of data and contact tracing among these Marin schools have shown that with nearly 40,000 students and over 5,000 staff, over more than 60 days of in-person school, there have only been 2 cases of in-school COVID transmission, and that involved 2 teachers, providing Zoom instruction in the same classroom. In Europe and many parts of Asia, schools have remained open for in-person instruction despite significant surges in community disease prevalence without a commensurate surge in disease transmission during school. So the data suggests that school is a very safe place for students and teachers, provided appropriate protocols are followed. In the meanwhile, we're increasingly realizing the heavy toll that long-term school closures are having on children's academic performance, mental health, and emotional well-being. Rates of depression, anxiety, and suicidal thoughts among children and adolescents have risen dramatically. Schools are safe havens for so many children, providing food, social support, and caring adult eyes watching out for children at risk. Poor children, particularly children of color, are being disproportionately affected by school closures, further widening the achievement gap between poor children and those of greater means.